we have to recognize and redistribute the burden of unpaid care work and recognize and mainstream paid informal work. Welcome back to this course on decent work for women. This video is part of the third module, where we previously set out the agenda for transforming the gendered social norms that determine how work is valued and what work is considered valuable. 1. Recognizing and redistributing unpaid care work. And 2. Recognizing and mainstreaming paid informal work. Along with doing so in other spheres of life, including in our personal lives, we must also pursue these objectives in the realm of law and policy. First, we will look at the Mahatma Gandhi National Rural Employment Guarantee Act of 2005. This is an Indian labour law and social security measure that aims to guarantee the right to work. It was initiated with the objective of enhancing livelihood security in rural areas by providing at least 100 days of guaranteed wage employment in a financial year to every household whose adult members volunteer to do unskilled manual work. Employment under MGNREGA is a legal entitlement. The state has to provide employment within 5 kilometers of an applicant's residence, and minimum wages must be paid. If work is not provided within 15 days of applying, applicants are entitled to an unemployment allowance. As we have learned, because of structural barriers, women are much less likely than men to take up paid work and also formal work. Simply by creating a legal entitlement to paid unskilled work locally at the minimum wage, the MNREGA lowers some of those barriers. In addition to this, 3 provisions of the MNREGA are important for women and decent work. Firstly, 1/3 of all work under the MNREGA must be allocated to women. Secondly, there can be no discrimination on the basis of gender for wages under the MNREGA. Thirdly, childcare facilities have to be provided at MNREGA work sites in some circumstances. If more than 5 children below the age of 5 years accompany the women workers to a work site, then one of those women must be deputed to look after such children, and that woman must be paid the wage rate for her work. We have learned that the burden of unpaid care work at home is one significant barrier for women to participate in paid formal work. These provisions in the MNREGA lower that barrier. They can be the focal points of advocacy and mobilization towards ensuring decent work for women in rural India. Firstly, for example, we can mobilize and organize to seek their proper implementation. One forum to advocate for the implementation of these provisions is the process of social audit. Social audits focus on the performance of a program in fulfilling its intended social objectives and ethical vision through consultation with a range of stakeholders, including its intended beneficiaries, community members, government officials, and then verifying the information obtained with documents and physical evidence. Social audits for the MNREGA are mandatory. They are coordinated at the level of Gram Panchayats, and the process includes public hearings. Questions related to the payment of equal wages, the allocation of work to women workers, and the provision of care at work sites can be raised as part of this process of social audit. Another step to improve the implementation of these provisions is to increase awareness about them. For example, increased awareness about the legal entitlement to childcare at MNREGA work sites can increase the number of women who demand work under the program. We can also advocate for expanding the coverage of some of these provisions. For example, we can advocate for better coordination between the MNREGA and the Indian government's integrated child development services. The ICDS program provides health and nutritional services to children under the age of 6 and their mothers through a network of rural childcare centers. Improved coordination between these two programs, perhaps by keeping the childcare centers open during MNREGA working hours, may improve the choice of childcare available to women MNREGA workers. We can also advocate that the law be amended so that childcare is provided not only when children accompany workers to the worksite, but also when workers demand that they need childcare facilities at the worksite. In summary, the barriers that rural women face in demanding work from the MNREGA program may be reduced by improving the implementation of the legal entitlement to childcare facilities and by increasing the coverage of that entitlement. Let us now look at another law, one that provides women workers with remedies against some exploitative aspects of work. In a previous module of this course, we learnt that the Sexual Harassment of Women at Workplace, Prevention, Prohibition and Redressal Act of 2013 places a duty on employers to establish and maintain a complaints mechanism to investigate and redress complaints of sexual harassment by any aggrieved woman. Women, including those employed at that establishment, have a right to file complaints of sexual harassment with the Internal Complaints Committee of that particular establishment. The law sets out the details of how this committee has to be constituted, the time-bound procedure that it must follow to investigate complaints of sexual harassment, and the penalties ranging from a written apology to the termination of employment that it can recommend to the employer following a finding of guilt. The mechanism set out under this law is an alternative to filing a complaint with the police. What then happens to women workers who do not have a formal relationship of employment with a single identifiable employer? Informal workers such as agricultural laborers and domestic workers, home-based workers, and self-employed workers do not ordinarily have a single identifiable employer. As we have learned in this course, these are the types of paid work that are more available to Indian women. We have also learned how such workers are especially at risk of sexual harassment and violence at the workplace, perhaps because they are more vulnerable financially and do not have many of the other protections offered by labor laws. The state government's district officer or collector is required to set up a local committee in each district. These local committees are expected to perform the role that full internal complaints committees do for establishments that employ less than 10 workers and for women working in the informal sector. However, a 2018 report evaluating 655 districts in India found that a majority of districts had failed to set up these committees. This means that most often, the remedy against workplace sexual harassment for women in the informal sector is ineffective. The legal protection is therefore only available to a tiny minority of India's women workers. To ensure decent work for women workers, we must demand the same access to justice through the local committees as other workers receive through the workplace internal complaints committees. Let us now go through some steps that can strengthen the remedy for informal sector workers. We can demand that district administrations establish local committees where they have not been set up. We can demand that local district administrations regularly publish the data about the number of sexual harassment complaints filed and resolved by the local committees. We can demand that local committees perform their duty under the law to conduct regular awareness and sensitization sessions about the law. This must include awareness campaigns among informal workers so that they are aware of how to file complaints to local committees. Earlier in this video, we learned how the MNREGA mandates the provision of childcare facilities at work sites in some circumstances. We also noted that better care facilities can further incentivize rural women to demand paid work under the program. Previously in this module, we learnt why it is important to recognize and redistribute the burden of unpaid care work. With this video, we have underlined the key role of policies related to care in ensuring the economic empowerment of women. As with the MNREGA, other labor policies of the government can also be modified so that affordable, good quality and accessible care services are available to all. Secondly, we looked at India's workplace sexual harassment law from the perspective of informal sector workers. We learned how most informal workers do not yet have an effective remedy against workplace sexual harassment. This analysis demonstrated how laws and policies that protect workers can be widened to include informal sector workers. Before we conclude this video, let us consider the Unorganized Workers Social Security Act of 2008. We learnt in the last video that most of India's social security schemes and programs, such as the Provident Fund scheme and the ESI scheme, do not apply to informal workers. This 2008 law was an attempt to provide some social security benefits to this category of workers. You must also remember now that a social security code has been passed, which may soon replace all of these laws. But let us set that aside for a moment and look at the UWSS Act. The law gives the central government powers to create welfare schemes in 4 types of social security and the same power to state governments in 7 different types of social security. The schemes created by these governments may be fully funded by these governments or partly funded by them along with contributions from the workers and their employers. It also creates social security boards at the national and state levels to, among other things, advise these governments on suitable schemes and to review the performance of these schemes. It also says that unorganized sector workers can be registered if they are at least 14 years old and if they self-attest that they are part of the unorganized sector. Now, perform a similar analysis of this law. The objective of your analysis should be to understand whether this law provides sufficient social security coverage to informal sector workers. As part of your analysis, you can also see the standards set out under the Social Security Minimum Standards Convention of 1952, which is Convention 102 of the ILO, and the Social Protection Flows Recommendation of 2012, which is Convention number 202. After that, you can try to formulate your own recommendation for how this law can be improved. Find out how many schemes have been made by the central government and your state government using their powers under this law. What schemes have been recommended by the different social security boards? Have any of them recommended schemes that are universal instead of sectoral, meaning that they apply to all informal sector workers, or do they only apply to specific types such as taxi drivers, domestic workers, and so on? What proportion of informal sector workers are covered by these schemes? What is the mode of funding that they have recommended for these schemes? Find out how unorganized sector workers are being registered by the district administrations. Are they applying any criteria beyond the 2 that are listed in the law? How many documents does a worker need to show in order to register under this law? By asking these questions, you will be able to understand the gaps in the implementation of this law. Thinking about what changes to the existing law can increase the coverage of social security benefits to informal sector workers is an essential part of the broader project of mainstreaming and visibilizing informal work. Thank you for watching.